Hi there, I'm Dr. Harris and this is me performing the back exam. Hi, nice to meet you. I'm Dr. Harris. Just quickly wash my hands. Today I'm going to be performing a back exam on you, which is going to involve me watching you walk, getting you to do some movements, having a feel of your back, and then getting you to lie in the bed while we get you to do some special tests. Is that all right?
Yes.
Good. Have you got any pain anywhere at the moment?
No.
No. And have you got any problems with your back?
No.
Excellent. So first of all, what I'd like you to do is just simply walk towards the camera and then walk towards the wall for me, please. So I'm just assessing the patient's gait, just looking for any antalgia, any abnormal posture. That's fantastic. On your way back to the camera, if you just walk on your tiptoes for me. Perfect. And this is just assessing the patient's function, so function of the calves. Excellent. And then on your way back, if you just walk on your heels, and function of the gluteals and quadriceps. Excellent. Once you get back to the start, if you turn and face us, and if you just perform a squat for me. So again, this is just another assessment of function. Lovely. That's great. So first of all, I'm going to start by just inspecting the patient's back. So if you can turn your back this way for me. So I'm just looking at the back of the patient. I'm assessing just for any asymmetry in the back, any abnormal posture, so any marked kyphosis or scoliosis, any asymmetry or any wasting of the paraspinal muscles. Again, looking for any obvious scars and any abnormal hair growth. Again, I'm just going to look from the side to assess the normal lordosis of the C-spine, kyphosis of the thoracic spine, and lumbar lordosis. This all appears to be normal within this patient. And now I'm going to start palpating. So first of all, I'm going to assess the whole of your spine. So I'm going to start up at your neck and feel all the way down to your pelvis, okay? So first of all, I always start by feeling the bony aspects of the spine. So mainly feeling for any tenderness that I can elicit, but for any prominent abnormalities as well. Any problem here?
No.
No. Okay, so feeling all the way down into the pelvis, and then palpating also over the sacroiliac joints as well. Any pain in there? No. Excellent. Then I'm going to feel down the paraspinal muscles. So again, feeling for any tenderness, any marked asymmetry or wasting, and any sort of trigger points. Any problems there?
No.
No. Good. And we'll just do the other side. Perfect. Is that all okay?
Yes.
Good. So I've inspected the patient so far and palpated, so I'm going to get on to the patient to do some movements. So if you turn around and face me this way. So I'm going to assess the whole of your spine. So first of all, we'll start with movements of your neck, okay? So if I can get you to put your chin to your chest, lovely, back up, look up at the ceiling, excellent, and put your ear to your shoulder, ear to your other shoulder, good, and then looking over your shoulder. Any pain at any point?
No.
No. Good. So the patient has good range of movement in the C-spine. Next, I just want to assess the movement in your thoracic spine. So if you can cross your arms in front of me, I'm just going to stand behind you, so you take a small step forward, stabilise your pelvis, and what I want you to do is just rotate with your upper body. Good. And the other way. So this patient has good rotation of their thoracic spine. If you just take a step back. The next thing we're going to do is movement of the lumbar spine. So first thing I'd like you to do is just bend forward and touch your toes if possible for me. So this is assessing forward flexion. This gentleman has quite marked tightness in his hamstrings, but otherwise he has good forward flexion. And if you can lean back for me. Excellent, so assessing extension and then lateral flexion. So if you can lean down, perfect, and the other direction. Lovely. Any pain at any point? This gentleman has good range of movement in his lumbar spine as well as thoracic and cervical spine, with no pain on any movements either. So after doing movements, it's good to move on to special tests. So while the patient is standing, I'm going to do two special tests. The first of which is Schober's to see if there's any stiffness in movement or lack of movement within the lumbar spine. So if I can just get you to turn around for me, I'm just going to grab my tape measure. So what I'm going to do is just pull your shorts down ever so slightly. So just finding the posterior superior iliac spine, and I'm just going to make a mark there. What I'm then going to do is measure 10 centimetres above and 5 centimetres below, just there. And then what I'd like you to do is just lean forward for me, please. So I'm measuring between these marks, and the movement is greater than 20 centimetres, so there's no issues with any, thank you, lack of movement within the lumbar spine. Whilst the patient is still standing, the other special test I'd like to do is the stalk test to see if I can elicit any pain within the sacroiliac joints. So what I'd like you to do is stand on your right leg for me, please, and then lean backwards towards me. I'm here to support you if needed. Do you get any pain over this area?
No.
No. That's good. Back onto your feet, and then do the same on the other leg. Lean backwards for me, please. Any pain?
No.
No. Excellent. So any pain over the sacroiliac joints would be a positive test. If I can get you to sit on the edge of the bed for me. Next thing I'm going to perform is the slump test. So this is looking for any neural irritation within the spine. So what I'd like you to do is slump forward, possible for me, not quite that far, that's perfect. And what I'd like to do is bring your right leg out straight in front of you. Any pain at all?
No.
No. I'm just going to pull your foot up towards you as well. Any pain in your back?
No.
No. Excellent. And then if we do that on the other side, so left leg out straight for me. Any pain?
No.
Any pain at all?
No.
No. Fantastic. Lovely. Right, lie down on the bed for me. So with the patient lying, the first test that I'm going to do is straight leg raise. So this is looking for any sciatic nerve irritation and trying to elicit the sciatic nerve pain that the patient may be experiencing. So what I'm going to do is going to lift both of your legs in turn. Just let me lift them and let me know if you get any pain at any point. So start with your right leg. So I'm going to lift your leg up in the air. Any shooting pains up your leg to your foot? No. If the patient did feel any shooting pains, what I would do is lower the leg to below where the pain was experienced and then dorsiflex the foot to see if that elicited the same symptoms, or stretching the sciatic nerve. And then we'll do it on the other side. Any pain at all? No. Good. While the patient is lying on their back, I'd also like to perform Farber's test. And this again, like the stalk test, is looking for any sacroiliac joint irritation. So what we're going to do is, with your right leg, I want you to cross it onto your other leg in a 4 shape. That's it, perfect. And what I'm going to do is just place a hand on your pelvis just to keep it still, and then just apply some pressure to your knee. Okay. What I want you to do is tell me if you've got any pain in the back of your pelvis. No, good. And if you could do that the other way around. Perfect. Any pain?
No.
No. Lovely. Great. The next test I would want to do is the femoral stretch test, which requires the patient lying on their front, if that's all right. Much like this straight leg raise, trying to elicit any pain like stretching the femoral nerve. So first of all, what I'm going to get you to do is just bend this leg at your knee, and I'm just going to bring it up in the air. I just want you to tell me if you get any pain in your anterior thigh, the front of your thigh.
No.
No. On the other side. Any pain at all?
No.
No. That's great. Lovely, you can lie back on your front. So this concludes all my special tests, but what's really important with the spinal examination is also testing neurology within the lower limbs. So first of all, I'm going to start off by assessing tone. So first of all, I'm just going to roll your legs around, just keep them nice and relaxed for me. The patient has normal tone. And moving on to power. So just get you to do some movements with your legs. If you keep your legs straight and lift it up in the air for me. Good. Keep your legs straight and push it down into the bed. And on the other side, so up and down. Good. If you bend both of your knees for me. So all the time that I'm comparing both sides, kick me away with this leg and pull me towards you. Kick me away and pull me towards you. Good. Straighten your legs for me. Bring your feet back towards you. Push against my hands and then push down like a car pedal. We do exactly the same with your big toes and down. Good. Next thing we're going to assess is just sensation in all the dermatomes that you have in your leg. We're going to do both sides at the same time. Can you feel me touching you here?
Yes.
Does it feel the same on both sides?
Yes.
Tell me if it's any different. Here?
Yeah.
Here?
Yeah.
Here?
Yeah.
Here?
Yeah.
Here?
Yeah.
Good. Next, I would like to do reflexes. Unfortunately, I don't have a tendon hammer with me, but what I would do is test reflexes at the knees, ankle, and the plantar reflex as well. Involving that, I can also look for clonus by moving the ankles. So there's just a beat of clonus there, which is normal. If there was any issues like clonus present or an upward plantar response, that would signify an upper motor neuron lesion, whereas with the lumbar back, we're looking for lower motor neuron lesions of the nerves coming out of the spine. The last thing we'd like to do is look at your coordination. So if you could place the heel of your right foot on your knee, dragging it down and keep on going backwards and forwards. Lovely, and then the other leg as well. Perfect. So far the patient has a normal neurological examination. To complete my examination, you should always examine the joint above or below where you're examining, so I could examine the hips. And also to ensure that the legs are fully neurovascularly intact, I could also assess for capillary refill and the pulses within the feet to make sure they have a good vascular supply. So in summary, this patient does not have any back problems or any pain at present. He had a normal gait and normal inspection with no obvious deformities to the back. He had good movement of the C-spine, thoracic spine and lumbar spine. And on special tests, we couldn't elicit any issues with the sacroiliac joints, sciatic or femoral nerves. He's also got full neurological function in his lower limbs. This completes my examination. Thank you very much.